There's a lot of confusion amongst doctors and patients as to what the different heat-based therapies do, how they affect you long-term, and which one's better. You'll never get a straight answer to any of that, but I tend to tell my patients that amongst the radiofrequencies that are really good for skin tightening, I prefer Profound and Morpheus 8. Those tend to be the best two. Profound is a true bipolar radiofrequency that inserts needles into the skin. They're actually pairs of electrodes, so it's a much more controlled type of radiofrequency, and you do it one time, you get fat for a week, and it tightens your face over the course of a year. Probably lasts like 4 or 5 years. I've had the device myself for about 4 years. I've seen no loss of effect over those 4 years. It's a very impressive device, and I never tell people it lifts. I never tell people it does anything like a facelift. It's skin quality improvement and skin tightening. So if you look at someone's nasolabial fold in a before and after photo, it tends to get about 25 to 30% better on most people. And everybody reacts differently. The success rate is 100% based upon patient satisfaction, but there are some people who get a much bigger effect than others, and the only way you're going to know if you're happy with this device is you look on the website, for example, you see the before and after photos. You look at the before and after photo with the least amount of effect, in your opinion, and if you think you'd be happy with the least amount, then you're definitely going to be happy with the treatment. She's going to go home today looking chubby. I like to compare it to the Nutty Professor. They're going to look chubby like that for about 4 or 5 days, maybe a week. At the end of the week, they have a little light hue of yellow from the bruising going away. At the end of 2 weeks, that hue is gone. What you notice is over the course of the following year, improvements keep increasing. So at about a month, they'll see some result. 3 months, they'll see 50% of the result, and a year, they'll see 100% of the result, which lasts about 4 years or so after that. The patient is awake for the whole thing. It's just numbing medicine and nothing else. We now use a little bit of an oral inhalant anesthetic, nitrous, which is laughing gas, and we give it to him at the same time, so it's much more tolerable. It's the most impressive that I've seen. Second most impressive is the Morpheus 8. Morpheus can't usually get to what Profound gets to overall, but it's more versatile. Morpheus was based upon the old Fractora. It is a great modification to the old Fractora. Now you can go between 1 and 4 millimeters in depth. It's got little electrodes that come down with 2 grounds on the side, so it's pretty well controlled. It has a little bit more propensity towards little bits of pigmentation formation than Profound does, but it's pretty uncommon. So it's a really nice device. The good thing about it is you can treat superficial pores, or you can go down 4 millimeters and treat the fat. So it's a pretty cool device that you can use for all those things, but you do have to repeat it a couple of times. Morpheus is usually performed about 3 or 4 times to get its intended result. The other radiofrequency treatments are totally different. They're used usually for more superficial types of therapy. They don't get as much skin tightening as you would want, but they do a good job improving the appearance of pores and texture of the skin. The older types of treatments, Thermage and Althera, are still used. If they're used with the classic treatment settings, they're fine. They just don't get as big of a result as the newer technologies do. When people try to crank up the energy, that's when you see problems, and I would avoid doing that over and over again, trying to get a result or trying to maintain a result. You don't want to do Althera or Thermage twice a year for your whole life. You're going to eventually cause heat contracture or fibrosis within the skin, and it's not going to look so good in the long run.